I'm joined by Dr. Joyce Locke, the Medical Officer of Health for Southwestern Public Health. Welcome again, Dr. Locke.
Great to be with you.
Things are looking good in our region again. I see on the website there's been no new cases reported since April 25th.
Yes, we're doing well. The case count is going down steadily, and we're getting control of the outbreak, and we're very happy about that.
And of the current cases, can you give us a little breakdown of what stages that they're at? Are any people on ventilators?
So again, all the cases that we have are people with mild disease. They are at home recovery, and nobody's in the hospital anymore, and we don't have anybody on ventilators, which is consistent with the fact that about 80% of people get mild disease and get better. It's only our vulnerable ones who end up doing not so well.
That's great news. There's a new graph on the website, percent positivity. Can you explain what this means?
So percent positivity is a number that helps us to figure out if there is spread in the community or if there are cases that we're not actually picking up. So if the number gets smaller, it's better. So the number reflects the number of positive cases among all the tests we did. So if you did 100 tests and 10 were positive, then you'd have a percent positivity of 10%. The smaller the number, the more it means that most of our tests are negative and very few are positive. And if most of our tests are negative, that means there can't be that much COVID-19 out there.
Understand. Now, I think people are feeling pretty safe in these smaller communities, but how important is it to stay local? I mean, some people have cottages on Lake Erie they want to visit.
So this all gets down to trying to keep our clusters of infected people small. So the more you travel around, the more you come in contact with other groups of people. And so in case you were carrying the virus, that means your range of spread gets bigger. So yes, if you do have a cottage, we all want to visit it. That's okay, but then again, you got to stick to yourself. So if you go there, stick with your family, try to keep away from people in that other community so that you aren't accidentally the vector for spreading the disease from our community to their community.
Now, the province has allowed community gardens to reopen. What advice can you give to residents using these gardens? I know we have one in St. Thomas and...
So community gardens are important for all of us. They're a source of fresh food, and they also are a good way to build community cohesion and togetherness. They are good for your mental health to be out in the sun and work the garden. So we do want them to continue, but like all things this year, the new normal has to apply so that people have to do things with thinking about, okay, I'm going to garden, but at the same time, I have to not spread COVID virus around accidentally. So that means all the same things apply. You've got to wash your hands before you enter the garden. When you're in the garden, you got to stay 2 meters apart from people. If you use tools before you give the tool to someone else, you got to be sure that it's disinfected so that you don't accidentally spread through the tools you're using. And we also ask that people who are gardening use the gardens, but that other people don't go in there. Again, it's to keep that cluster small, just in case that we have someone who's carrying the COVID virus. It only spreads to other people who may have been in the garden and not to all kinds of visitors who are there. We have a guidance document on our website, and we've sent guidance documents out for the communities to share with our community gardeners to give them more direction.
Great. Well, let's hope the weather holds out. Now, the province has also said contact tracing will play an important role in the relaxing of emergency measures. Can you explain contact tracing?
Yes, contact tracing is a very important part of controlling the spread of the virus. So if we get a positive case, then we know that that person could have spread it to all the people they were in contact with. So then we get on the phone and we found all their contacts and we say, okay, you have to be extra careful because you could be having the virus starting to incubate inside of you. So we want you to self-isolate until you get through that incubation period so that we won't spread it any further than the index person, the first case, and their contacts.
And so does that happen once the test comes back positive? You reach out again to the people?
So we do it. So sometimes people come to our attention and we don't have the test result yet back. So they're called a suspect case. But even if they're still just a suspect case, we start gathering information about all their contacts. And we do tell the person to start maybe spreading the message around. Once we get the actual positive result, then we will reach out to all the contacts ourselves very quickly to get them to also stay home.
Gotcha. Now, I see Health Canada has reported a jump in cleaning product related poisonings in February and March. Can you offer any advice for people who are making their own cleaning products or hand sanitizers?
Yes. So people do need to be careful. In particular, we have to be careful of our children. They like to open up bottles and squirt bottles and often, put things in their mouth when they shouldn't. So yes, especially if you do mix something up, be sure that you put it in a safe spot away from curious hands and curious eyes. Also, be sure that you follow the directions we have available on our website about how to make a cleaning product so that you don't make it too strong. The virus is very easy to kill, so it only takes a really weak solution of bleach to do so. So as long as people stick with these safe guidelines, you can make your own home disinfectants and use them for your high-touch surfaces to keep them free of virus.
Great. And anything final for today?
The only thing I'll mention is that this is the season where seasonal allergies start to come out and people develop itchy eyes and runny nose. And this year, we do actually want people to be even more conscious about keeping their hands away from their eyes and nose. So if you know that you have seasonal allergies, maybe make sure that you've got your antihistamines or whatever medication you usually use handy so that you can try and decrease your symptoms and keep your hands away from your eyes and your nose and your mouth. And then that will help you to protect yourself from accidentally introducing the COVID virus to you.
Gotcha. Okay, thanks for your time today, Dr. Luck.
You have a great day.